I'm Dr. Jennifer Verbesey, and I'm one of the transplant surgeons here at the MedStar Georgetown Transplant Institute. And I'm both the director of the Living Donor Kidney Transplant Program and the Pediatric Kidney Transplant Program. The Living Donor Program at the MedStar Georgetown Transplant Institute is a really well-developed program. We strongly advocate for patients to try to see if they have a living donor. Living donor transplants tend to work faster and last longer than the cadaveric counterparts. Also, we can do it on a planned day so that we can schedule the surgery. In addition, we can often transplant people before they ever go on dialysis. And that's very important because many studies have shown that your outcome after being on dialysis tend to go down the longer that you're on dialysis before transplant. So we actually aim to do a lot of people as preemptive transplants, which means that they actually get the transplant before they ever start dialysis. Here at our center, donor safety is absolutely our #1 priority. So donors come in and they undergo a full day evaluation, and during that time they meet with a nephrologist who's going to look at their kidney function, they meet with a surgeon who's going to look at their surgical anatomy and explain the surgery more to them, but they also meet with social workers and coordinators and financial advisors, etc. And basically what we're trying to do is we're trying to see, does this person have any risk factors for kidney disease in the future? But throughout the entire process, their safety is our #1 priority. And that means from the evaluation through the surgery, and we have very, very careful follow-up after. All of our donors have to come see us at 1 week, 6 months, 1 year, and 2 years. One reason that I love my job is I get to meet all different people who want to be donors. And every single one of them are amazing people, right? They're coming forward, they don't need a surgery, but they're coming forward to have one just to help someone else. All of those people are amazing people, and that's one thing I love every day. I get to meet people who are interested in doing this. I get to explore why they want to do it, and then I get to be with them throughout the whole process. I'm very lucky to work at the MedStar Georgetown Transplant Institute because my team and the people around me, we all have a passion for kidney transplant. When we see someone with end-stage renal disease, I swear we're thinking, why doesn't that person get a transplant? We know that we can have them regain a normal life again. So I think that we meet our patients, we get super involved with our patients, we're very concerned with them as a person. And we know that at the end of the road that we can provide something for them that will really improve the quality of their life and also improve the length of their life. And so we frequently meet. We are always trying to get those hard to transplant patients done, patients who are either very sensitized, patients that have had transplants in the past, patients that maybe have been turned down by other centers. We're very interested in trying to get those patients transplanted. Living donor kidney transplant has a lot of benefits for the recipient, and that is that usually these kidneys tend to work faster and last longer than a deceased donor kidney. Deceased donor kidneys are a fabulous gift as well, but living donor by and large has longer graft and patient survival times, sometimes even up to double the amount of time. In addition, we can often do these transplants before someone ever goes on dialysis. So whereas the waiting time for a deceased donor could be 3 to 5 years in the Washington, D.C. area, we can schedule a living donor transplant within weeks. So we can pick a day, it's a scheduled time, and we can do it before the person ever goes on dialysis, which is called a preemptive transplant. A child can receive an adult kidney. We do that all the time. Most frequently, in fact, a child will receive a kidney from either their mother or their father. And it's not without its challenges. It's challenging to put an adult kidney, but whereas for an adult, we make an incision on the side and we kind of tuck the kidney into a pocket. In a child, we usually make a midline incision and we fit the kidney into the abdomen. But most kids, when they get living donor transplants, will get a kidney from either a family member. It doesn't have to be a mother or father, but it could be an aunt and uncle or a friend or someone like that. MedStar Georgetown Transplant Institute is a wonderful choice for patients because we bring an enormous amount of experience and expertise to the table. Studies for almost all procedures have shown that the higher volume a center does, the better outcomes they have. And we're doing almost 200 kidney transplants a year here. We have very experienced nephrologists, surgeons, and our entire staff. We have a very well-established living donor program, and we have one of the safest laparoscopic donor nephrectomy programs around. Whenever a recipient comes in, we ask them to consider whether they have a living donor. If they do, we ask the living donor to contact us, or the recipient can also give us their information. The first thing that all donors do is they fill out a living donor questionnaire, and this is basically a screening process. There are certain things that don't let people be donors. So for example, if someone has diabetes, they can't be a donor because diabetes can lead to kidney disease in the future. But most people, even if they've had small medical problems in the past, can qualify. And so we ask everyone to fill out a living donor questionnaire, which, as I said, is a screening process. And after that, one of the coordinators will call the donors. And the first thing that happens is we get blood samples and we compare the donor and the recipient. We have to see if they're what's called a match. So donors and recipients have to be both the same blood type, and they also have to have a negative cross match. Once that happens, they're brought in for a full day evaluation. Sometimes a donor and recipient might not be a match, but there's not a very strong reaction between the two people. If that's true, sometimes the recipient can undergo what's called a desensitization procedure. And that means the patient has a procedure that basically washes their blood of the antibodies that were reacting to that donor. So even if at the beginning we think that a donor and recipient aren't a match, sometimes we can give medicines and do certain procedures that actually do let that donor give their kidney to that recipient. If we feel that that's not possible, so that their reaction between the two is very strong, or there's some other reasons that we just don't feel that this donor is the right donor for this recipient, we do a lot of things that are called swaps or exchanges. And what those are is if donor A comes in with donor B, and they can't go together for one reason or another, and I have donor C that goes to recipient D, and they can't go to each other, sometimes we can just swap so that donor A will go to the other recipient and donor C will go to the first recipient. So that works out a lot of times. So if we have two pairs, they can't donate to each other, we just swap the donor and recipients, and we still get 2 transplants done. And the same way we do 2 pairs, sometimes we could do 3, 4, 5, 6, many pairs. Georgetown has a great history of doing exchanges, and that's how we get a lot of difficult to transplant patients done here. You do not have to be a match for your recipient to come forward in our program. You may have to be a match to actually donate your kidney to your recipient. However, your recipient can only get a living donor transplant if they come with a donor. So even if you can't donate to your specific recipient, we may be able to get you into a swap or an exchange so that your recipient still gets a kidney. It may not be the one that you're giving, but they will still get a kidney because you came forward. Nowadays, people who want to donate a kidney can undergo a laparoscopic donor nephrectomy. Nephrectomy means we're taking one kidney out. And this is a big change. If people meet people who donated many years ago, they may see they have a huge incision on their side because they used to have to do an open procedure where they made a large incision. Sometimes they even took out part of the rib, and it was a major procedure for someone to undergo. Nowadays, our donors are much more lucky. So we do it laparoscopic, which means we use the video camera and our tools. And usually people have one incision that's about 6 centimeters long and 2 other incisions that are only about 1 centimeter each. Laparoscopic surgery helps the donor get over the surgery much more quickly. So usually our donors are in the hospital for 2 nights, and within about a week to 2 weeks, they're feeling almost back to normal. It takes a couple more weeks to get over a little bit of fatigue, but laparoscopic surgery helps people recover much more quickly with a lot less pain than they used to have. When a living donor pair comes forward, there's usually 4 options for them. One is they have an ABO and cross-match compatible transplant done. That means they have the same blood type. When we test their blood against each other, there's no reaction, and the donor can give right to the recipient. That's obviously the most straightforward, that's the easiest, everyone's happy, and the transplant gets done. But there are still several other options for the patients. The next kind is ABO incompatible. So you can have different blood types, but the reaction could be weak in the recipient. And if that's true, sometimes we can still give that donor to that recipient even though their blood type is different. Sometimes that requires a little medication and a few procedures before the surgery, but then we can go forward. The third kind is you can have the same blood type, but you can have what's called a positive cross-match. So there are antibodies in your system that react against that donor. Again, sometimes we can treat that patient with medications and something called plasmapheresis, which gets rid of those antibodies, and we can go ahead with the transplant. And the fourth thing is if we have a pair that either has a very strong antibody reaction or their blood type incompatible, and we feel that that donor just can't give to that recipient, then we enter those people in what's called the exchange pool. And we have a large pool of patients that are pairs that have come forward that can't donate to each other, and we're constantly checking that pool to see which pairs match each other. And as soon as we find a pair, then we can make either a swap, we can just have two pairs exchange donors, or we can make a chain, or sometimes we have 3 pairs, sometimes 4 pairs, sometimes more. And in that way, we hope to get all our donors and recipients done who come to the MedStar Georgetown Transplant Institute. If you are a person who is interested in donating a kidney and maybe you don't know someone possibly who needs a kidney, but you're still wondering if it's okay to donate, the answer is definitely yes. So every year we have a number of people who come forward. We call them non-directed donors. And they're just people for one reason or another. Maybe they know someone who is sick. Maybe they just feel that this is something that they want to do. And they come forward and want to donate a kidney. These people are incredibly special to us, not only because they're doing something that's so generous, but also we can often kick off an exchange with a non-directed donor. So in other words, when you come in and you just want to donate and we don't have to give a certain recipient a kidney, that can kick off many pairs going. And we often hope that we'll get 3, 4, 5, 6, 7 transplants done just because we have that one person to kick it off. So anyone who ever wants to donate a kidney, we would strongly recommend that they come forward and meet us. So many donors are concerned how donation might affect them financially. The good news is that the recipient's insurance pays for the surgery, the procedures, and anything that's related, any tests that need to be done, anything that's related to donation. They do have to take off work. I usually recommend that people take off work for about a month. About a week and 2 weeks, you're going to feel really good, but it takes a little more time before the fatigue is over and you can get back to work. We have social workers and financial people here that can always help just talk to your employers or to figure out what the best way for you to be able to do this. Also, we have several assistance programs, and so we have social workers that can help you apply for these assistance programs prior to donation. These assistance programs can provide several thousands of dollars that help with travel to the surgery and lost wages during this time. And the last thing is that the Transplant Institute here does have some places that people can stay when they come for donation. So we have social workers that can help you work that out as well. All of our donors undergo a full workup to make sure that they're healthy enough to undergo this procedure, and that includes basic demographics first. You have to be over age 18. And then we test your blood, and we're looking for any abnormal tests that may tell us that you're at risk for kidney disease in the future. It's very rare that anyone has a problem now that they don't know of, but we're looking, are there any signs that we have to worry about this person having problems later on? If there aren't, then when they come in and we have them meet a whole team of specialists that talk to them about the procedure so they can understand. And then everyone undergoes an MRI of their abdomen so we can look at your anatomy. You get a chest x-ray, an x-ray of your abdomen to make sure that there's no kidney stones or anything like that that we need to know of. And then we do some cardiac testing like an EKG, and depending on someone's age, sometimes they have to undergo an echo as well. We also have all our donors, they have to undergo proper cancer screening for their age group. And basically our goal is to make sure that you are extremely healthy at this point and that you're doing fine with your kidneys as they are, and you're going to do just as well with one kidney after. We want to make sure our donors can live their normal lives after. They don't have to alter their lives at all. They go out and pick up right where they left off, but now their recipient is living a healthy life as well. We develop a very strong relationship with our donors. I meet with the donors several times before donation. Obviously, we go through the whole surgery together. I see them post-operatively in the hospital multiple times. And then we see every donor in our offices at 1 week, 6 months, 1 year, and 2 years. Several of those visits involve having laboratory work done as well, so we can make sure the kidney function is where we want it to be. But really, our donors, I feel very comfortable that they know that they can call us at anytime. We have a coordinator that's just dedicated to donor care. They can call us anytime, and we would expect to have a lifelong relationship with the donors. If they want to come back and see us, if they have any issue, they're always welcome to call or come in to see us. Luckily, laparoscopic donor nephrectomies are a very safe procedure. So we feel very comfortable that we're providing a very safe procedure, safe surgery for our donors. However, with any surgery, there's a very, very small chance of complications. For our donors, the things that I worry the most about are clots in your legs that can move to your lungs. That's a risk of any surgery. And what we do is we take precautions. We put boots on all our patients and we get them up and walking by the first morning. The other things, there's a very, very small chance of injury to other organs. We do it laparoscopically, so if we ever got into any bleeding or any trouble like that, we could have to convert to an open procedure, which means someone would wake up with a bigger incision and be here a couple extra days. You know, knock on wood, that's never happened in recent history here, so these again are rare complications. After surgery, what we tell people, you could expect your blood pressure to be slightly higher than it was before surgery, but it shouldn't be clinically significantly higher. So if you're used to running, 110/70, after surgery, your blood pressure might be 120 over something, but it shouldn't be of any problem to you. In addition, you have lost a kidney, so your kidney numbers are going to be a little higher, and often donors have a little more protein in their urine. But again, it shouldn't create any problem for them, but it's just something that would be noticed if they went through laboratory tests or urine tests at all in the future. I think anybody that's considering living donor transplant should come to the MedStar Georgetown Transplant Institute to be evaluated. I really believe that we provide phenomenal care for our donors and our recipients. We get to know our donors very, very well. We'll take them through the entire process with us. I feel that we're very open for questions, always available to give you information, and we take our donor safety extremely seriously. In addition, we want our outcomes to be great. I always tell our patients, I have the exact same interests as you do. I want you to have a great experience, and I want your kidney to work for a long time, and I want you to be able to live a long, healthy life. We are on the same page. We have the same interests. And I think that our Transplant Institute here provides that. We have great outcomes. If people check our SRTR data that gives you patient and graft survival, I think they'll find that we're one of the tops in the nation. One of the best parts about my job is that I get to interact with the donors. Before, when people tend to be slightly nervous, which is what I would expect, that's totally normal, and after, when usually people are enormously satisfied that they decided to do this. So for example, today in clinic, I saw a mom who donated about 6 months ago to her 17-year-old son, and we both got a good cry out of it because he's doing wonderfully and he just graduated high school. And she is extremely happy, obviously, that she went through the procedure. I would say the vast majority, we're talking more than 99% of my donors come back, they're healthy, they feel fine. Almost everybody tells me that it has had no impact on their life. And the real gratifying thing for me is almost everybody is very happy that they went through it. Dialysis is a wonderful thing. It helps people who have end-stage renal disease. It helps them to go on and live. However, it's a very difficult way to live. You know, our patients are in dialysis centers 3 days a week, 4 hours each time. And unfortunately, dialysis is fraught with complications. People have infections, trouble with access. It's a very difficult way to live. And transplant can be an answer for those people. So we strongly recommend anyone who's on dialysis to come forward and get evaluated for transplant. Over and over again, transplant has been shown to both extend people's lives and improve the quality of patients' lives. Living donor transplant is a great option for people because it can allow someone to have a transplant before they ever start dialysis. And this can be very advantageous to patients. First, patients who wait for cadaveric organs can wait 3 to 5 years. So it's not just that you're going to start dialysis, but that you're going to be on dialysis for years. And dialysis has a lot of complications, unfortunately. You're very prone to infections. You have to worry about access, where they're going to do the dialysis through. And also cardiovascular risks go up the whole time that you're on dialysis. Many studies have shown that the shorter someone's on dialysis, the longer a transplant, both the graft and the patient will survive. So we try to get patients transplanted as soon as possible. And that's why if a patient has a living donor, we can often do it before they ever start dialysis. And so we aim for this. This is called a preemptive transplant, and that's a really great thing if we can get accomplished. As my job as the director of the pediatric kidney transplant program, I see almost all the pediatric patients that come through. And again, we encourage, if there's any way for a child to get a living donor transplant, that's really the best, because you should understand that kidneys don't last forever, unfortunately. So we hope to get many, many years out of it, but usually if a child has a transplant at a very young age, they're going to need further transplants in the future. So the first transplant is always the most important. So we try to get a living donor transplant that's going to last the longest and work the best. We develop very long-term relationships. I love to get letters from my patients later telling me about how they're doing. And you know, transplant surgery is very gratifying in that you take someone who was sick before, we do a surgery, we fool around with medications for a while, and then they hopefully will go on and live a normal life and have fun with their families and go to weddings and go to bar mitzvahs and go to parties and graduate from high school and college. And so it's extremely gratifying for me to be a part of that.